Hello everyone on Facebook. My name is Fauzi and you are watching Off the Record. Now, Off the Record is our weekly live show happening every Saturday at 8 p.m. where we invite guests to answer your questions about COVID-19 and other related concerns you might have. Now, before we go any further, please do us a favor and give us a like if you enjoy this video, and remember to share the link to our show with all your family and friends. So everyone you know, basically. All right? So last week, I spoke to Minister of State Sun Xueling and Dr. Chrissy Lim about the recently rolled out vaccination exercise for students. And as always, if you missed that or any of the previous episodes, feel free to check out the recordings after this stream. But today, I am pretty sure I'm not the only one who is excited because we're talking about Singapore's efforts against COVID-19, and who better to talk about this than Minister for Finance and co-chair of the Multi-Ministry Task Force, Mr. Lawrence Wong.
Hello, Fauzi. Good to see you.
Thank you very much for coming here.
Thank you.
All right. Now, for everyone tuning in, I want this to be as interactive as possible. So if you have any questions for Minister Wong, please leave them in the comments below and we will compile them for him to answer later on during the stream. All right. But to get us started this evening, I do have a list of questions that you can help us address, Minister Wong.
Happy to do so.
Okay, are you ready?
Yes, of course.
Let's get started. All right. Now, we seem to be in a very different situation compared to when the outbreak first started, maybe more than 1 year ago, right? Mm-hmm. Correct? Why is this so? And is the virus variant more infectious now?
It certainly is. That's one reason why it's very different from last year. This variant, which we call the Delta variant, it's originated from India.
Right.
Of course, it's not the first time we've seen a variant. I think people may recall the variant from the UK, which is now called the Alpha variant. Mm-hmm. Now, the Alpha variant is about 50% more transmissible or infectious than the original strain from Wuhan.
Right.
And the Delta variant is 60% more infectious than the Alpha variant. Mm-hmm. So effectively, we're talking about a variant that is about 2.5 times more infectious than the original strain. It really is a super spreader variant.
I see.
And that's why even in this latest wave of cases, we are seeing breakouts in places which we never saw before last year. In shopping centers, in markets, large clusters which didn't happen last year. And it's also the reason why this Delta variant has now become the dominant variant around the world. But this is the not so good news, right? And it's unfortunate. It's a very infectious strain. In fact, there are even suggestions that it is causing more severe disease in some places. So this is the bad news. But the good news for us, I think to sort of take note of, that's different this time around compared to a year ago, is that number one, we are doing more tests and our testing capabilities have improved. We are doing not only the regular tests using the labs, but we have fast test kits now, which we are distributing, particularly for the workers in high-risk settings. And then number two, we are doing faster and more comprehensive contact tracing. We got Trace Together, we got Safe Entry, so we can get the data faster and we can do the ring fencing and contain the clusters more quickly. And thirdly, and very importantly, this is the game changer, we are vaccinating everyone. And our vaccination rates are continuing to rise. So these are our key three strategies: test, trace, and vaccinate. And we will double down and work very hard across all three fronts to keep everyone in Singapore safe.
Fantastic. There are over, I just got news that there are over 600 people watching this right now. So you can say hi to all of them.
Hello, everyone.
All right. Very nice. Very nice. Okay. Next question. What are some of the planning parameters when it comes to safe management measures? How are we basically keeping Singaporeans safe?
Well, you have to look at how the virus spreads. And if you talk to the experts, they will tell you, of course, there are many factors, but there are 4 key factors to be aware of. One, what kind of activity do you engage in? Obviously, if we are keeping quiet, the risk is very different than if we were to sing, because the droplets, with force of exertion, you get a wider spread of droplets. So activity level matters. Then, 3 other factors, and they are what they call the 3 Ds. Density, distance, and duration. Right? So the classic example is if you are in a room, small room, many people, and all of you are singing. Then obviously activity is a risk factor, density is a risk factor, distance is a risk factor, and duration, if you spend more than half an hour there, it's a risk factor. That's a very high risk setting.
Right.
And that's why we have not been able to allow karaoke clubs to resume even till today. And this is so in many other places. We take another example, public transport. People say, well, that also seems like a bit of a high risk, isn't it?
Yep.
Because we are all seated together, quite dense. So there are ways to reduce the risk factors, and that's to your question, how we design the safe management measures.
Right.
So in a public transport, we say keep quiet. So if you don't talk, then you reduce that risk factor. We say wear a mask. So you may not be able to keep a distance in public transport, but with the mask, it helps to provide some distance between you and another person. And we have good ventilation in the trains, for example. They continue to replenish the airflow. So you can reduce the risk of density and distance with safe management measures. So that's exactly what safe management measures do. They help to reduce risk factors along the different dimensions which I just described. So again, another example, F&B. We all want to look forward to dining, of course,
Yes.
with a limit of 2 persons
Right.
on Monday.
Yep.
What can we do to reduce the risk factors? Obviously, with dining, I can't say eat with a mask on, right? So the best we can do is when you're eating, yes, you take your mask off, but otherwise keep your mask on after that. And then make sure that you are 1 meter apart from the next diner.
Right.
And we have put in place a new restriction to say no music, no background music, and no screening of TV and all that, and no live performances. And the simple reason for that, again, is to say you go to eat, fine, but if there is background music, if there's live performance, if it's very noisy, it's very likely that you'll be talking very loudly. And if everyone is talking very loudly in an enclosed space, then again there is high risk because droplets are being spread, aerosolized, and it's very easy, if there is one case in the restaurant, for everyone to get infected. So those are the different ways where safe management measures are designed specifically to address all of these different risk factors.
Right. I mean, amazing. Like me listening to you right now, I feel like I'm very convinced now. Like it's been broken down so simply. I feel like everyone would be able to understand the reasons why.
I hope so.
I hope so. Yeah, I hope so. I feel like the people out there probably understand it a little bit clearer now that it's kind of been broken down that way. All right, we have the next question here. Now, you recently announced an $800 million support package to help businesses and workers cope with the impact of the tightened measures. How does the government know who to help?
Obviously, the impact of this recent heightened alert is quite different from, say, the circuit breaker last year.
Right.
When we had the circuit breaker last year, it was more like a general lockdown. Many activities were shut, and therefore we provided significant help across the board. This time round, when we did the heightened alert, we didn't do a general lockdown. Instead, we took targeted measures, and we said, what's the highest risk amongst all the different risks we have to face? And the highest risk are activities where we are indoors without mask. And that's why we specifically restricted dining in, gyms, fitness centers.
Right.
So we focused on these specific settings. So I think in this heightened alert, many sectors were able to continue business, and that's why we knew which sectors they were. The ones that were most affected were the ones where we put in place the restrictions,
Yes.
F&B, dining, gyms, fitness centers. So we knew where they were, and that's why we were able to design measures targeted at the affected sectors. For the affected sectors, this heightened alert felt like a lockdown. I mean, it didn't feel like a lockdown for the other sectors.
Right.
Construction continuing, manufacturing continuing, but for gyms, fitness centers, F&B, to some extent retail, because they were affected by footfall, it felt like a lockdown, and so we targeted our support measures to these areas.
Nice. All right. Fantastic. So on that note, right, with the government spending more to support Singaporeans, will we ever run out of money? It's quite an interesting question.
Well, I would say there is always a risk that we can run out of money. It's not as though we have endless supply of money. And this is the thing, right? Everybody thinks that we had the somehow in Singapore the government has a lot of money because we have this humongous reserves, and so the feeling is it's okay, spend a little bit more. What does it? What harm, right?
Yeah.
Spend a little bit more, and I can understand that kind of a feeling. But if each time you say that, every year, year by year, you say that, that's exactly how you end up with a culture of entitlement,
Right.
and you start to spend away the reserves very quickly. It's exactly why people say wealth does not last 3 generations, because it's very tempting.
Right.
You got money, let's spend a little bit more. What does it hurt? And then very soon you find that, as you said, as the question says, you don't have any more money.
Yeah.
So we are trying very hard to make sure that, yes, I think it's in a crisis. We have to use our reserves, but we do it only in an emergency, and we use it sparingly. Other than that, and when things have improved, we should try to get back as soon as possible to a balanced budget and live within our own means.
Yep.
And I think fostering that culture of responsibility is very important. And it's also very important to ensure that we leave behind something better for the next generation.
Very nice. Okay, awesome. Now, the next question is about the vaccination exercises. Yeah. Now, the vaccination exercise is ramping up. In fact, Minister Ong he said that over 50% of our population have received at least one dose of the COVID-19 vaccine, and 36% both doses.
That's right.
So I think maybe this is the best time to reiterate how important is the vaccination in the fight against COVID-19.
It is extremely crucial. This is the key measure. Vaccination is the key measure that will allow us to reopen safely. So we really need everyone to step forward and get vaccinated when their turn comes. By doing so, when you are vaccinated, you not only protect yourself, because it's very clear from evidence we have in Singapore and everywhere around the world, that the vaccinated person, yes, from time to time, you may get infected. But even if you are infected, once you are vaccinated, you will only get mild symptoms. The likelihood of a severe illness is very, very low. So it pays to get vaccinated. You will protect yourself. First benefit. And the second benefit is when more people are vaccinated in the society, there is clearly evidence around the world that it helps to reduce transmission rates of the virus, which means that when more people in Singapore are vaccinated, we will have the confidence to start opening up without worrying that there will be another major outbreak that will cause a lot of people to fall ill, to be hospitalized, and a lot of people to end up in the hospital beds or getting in ICU, and then eventually high fatality, which we want to avoid.
Right.
So vaccination is really critical, and that's why we've talked about 2 milestones. You mentioned Min Ong saying that we have 50% first dose. That's good. That's a indication of coverage, but we also want to get to 50%, 2 doses, fully vaccinated. We think we might get there by August, hopefully earlier. Obviously, the ones with the first dose, 6 weeks later will get the second dose. So we hope we will get there by sometime in August. That's an important milestone. At least half of the people in Singapore will be fully vaccinated. And then the next milestone would be when 75% of our people are vaccinated, and we hope to get there by October, if not earlier. It really depends on our supplies of vaccines, which we are now talking to the manufacturers to see how we can bring forward the delivery schedule, and then we can get the vaccines rolled out to as many people in Singapore as possible.
Fantastic. I'm one of those people waiting to get...
Have you gotten your vaccine yet?
I'm getting mine...
registered your interest?
I have. No, I'm getting mine in next week, in fact.
Oh, you've already booked?
Yes.
Excellent.
So by August, I will be both doses down.
Very good.
Yes. All right. We are already, I think I got news that we are at 800 views. So 800 people are watching this again. Thank you very much, you guys, for joining us. I do have some viewer questions coming in already. But before that, maybe we'll do one question and then we'll get into the viewer questions. And the last question is, how are you coping during this period?
Well, it's obviously very challenging. I mean, I've been in public service for 25 years, 15 years as a civil servant, and then 10 years in politics, thereabouts. This is probably the most challenging thing I've had to do.
Yeah.
But the good thing is, obviously, it's not something I do by myself. I'm supported by an excellent team, and I'm always cheered by the tremendous response we get from Singaporeans. For the most part, the vast majority responding very well, doing their very best also to comply with the measures and to, do their part individually, taking responsible actions, and importantly, to support one another, especially the ones who are more disadvantaged and vulnerable. And I think that gives us confidence, all of us confidence, that we can get through this pandemic and emerge stronger as a nation.
There you have it, guys. All right, now, before we move on to the next segment, right, I want to take this opportunity to thank all of you for tuning in tonight. We really, really appreciate your support, and I'm sure Minister Wong does as well. Now, for those of you who are joining us here for the first time, we are here on Off the Record with Minister for Finance and co-chair of the Multi-Ministry Task Force, Mr. Lawrence Wong, who has taken time off his very busy schedule to talk to us, all right? So help us out by liking and sharing this video with all your friends and family so more people can catch it. All right, now, Minister Wong, for the next part, we have gathered over like 500 questions from Singaporeans, okay? And
we're not taking all 500 questions.
We're not. We're definitely, I don't think we'll be able to finish all of them. But we're going to also get some questions from the people watching as well. So if you have any more questions, please feel free to leave them in the comments as well, all right? Now, we are going to ask you some of these questions. They could be anything with regards to like vaccinations, community measures, or even about you, maybe, okay? So are you ready to take some of these questions?
Go ahead.
All right, I have one question here, and it is from Irvin Teo. All right, the question is, why are families, 2 parents, 2 kids, not allowed to sit together during dine-in in the next phase, and why do they have to split into 2 tables?
Yeah, no, I understand why families would prefer households, those in the same household say, look, we are already living together,
right?
Then why make it more difficult? But we do want to make sure that in the F&B setting, when we say it's a table of 2, it's easier to administer across the board, so everyone in a table, 2 persons. Right? There's no change, there's no deviation, it's just 2 persons. What we do allow is that if you are in the same household and you say you want to go out, then let's say you have 4 people, then you might do 2 tables, multiple tables, provided you are in the same household.
Right.
But if you are not from the same household and you just want to ask your friends to come, multiple table booking, that is not allowed.
Right.
So we give that concession to households precisely because they are living alone. And we say, fine, if you want to go out together, we won't stop you. You are already living together. But then you just have to let the F&B establishment know, your same household. They may ask you to check and verify.
Right.
But then you have to sit in separate tables.
I understand. But like, it can be adjacent tables.
That's right. That's right.
I understand. All right, very good. Yeah. All right, we've got one question here from Win Chu. How will F&B outlets be safeguarded against COVID-19 when dining begins on Monday?
Well, that's something that all of us must do our part, right? To ensure that even as dining resumes, we can keep F&B dining in a safe activity, or at least reduce the risk. And all the measures that I talked about. So a few things. Number one, for anyone who is not feeling well, please do not go out. I mean, that's just basic responsibility, right? Even if you feel like you have a scratchy throat, you think it's okay, but there's no need to take a risk. And furthermore, to take a risk by going to a restaurant where there will be many people and you are taking your mask off, I think that's very high risk. So the first thing is we appeal to everyone's individual sort of responsibility, right? Just do your part. Then number two, we have put in place all these rules like we talked about, 1 meter separation, keep your mask on if you're not eating, and then all the rules around no music, no live entertainment, hopefully to minimize the risk and reduce the risk further. And then thirdly, we are doing one new thing this time around, which is to have everyone who's working in the F&B sector tested more regularly.
Right.
So we are putting in place additional precautions compared to previously so that we try our best. We allow for some dining in, but we hopefully can reduce the risk of large clusters breaking out in these settings.
Nice. All right. Very good. Now, we've got one question from Raymond Thum, which is quite interesting. What must Singapore do to remain competitive in a world with limited travel and social interactions, considering outbreaks of COVID or future diseases will become more frequent or unpredictable even with vaccinations? It's a tough question.
No, well, it's a very important question because we do want to ensure that Singapore's competitiveness is not impaired by COVID or by any other future infectious disease or pandemics. Right now, is there an impact? Yes, unfortunately there is. Hopefully it is short term. There is an impact now because we've had to restrict measures, we have to close our borders. We can weather this short-term impact for a short time. I don't think that's a difficulty. But if we have to keep our borders shut for 1 year, I think many businesses will leave Singapore.
Yep.
We will certainly lose competitiveness, and at stake, it's not just about the companies that are here, but many jobs for Singaporeans will be at stake. So we are mindful of the risk, and that's why it goes back to the earlier point that at some stage we must be able to reopen our economy, and that includes reopening at the borders as well as within Singapore. All the restrictive measures should be eased progressively. But the only way for us to do that safely is when we reach a high enough vaccination coverage. So the key is still comes back to vaccines.
Right.
We have the vaccines, we have bought enough vaccines. And if you look around the world, the ones who have reached high levels of vaccine coverage would be Israel, America, some of the countries in Europe. Around Asia, actually, most countries are not at that same level. Right? Vaccination rates in Asia tend to be lagging behind. But we are not doing too badly.
Right.
And we have the supplies, we are trying to bring the supplies in, and like I said, we hope before too long, we will be able to reach our targets, and then we can start to ease up on the measures progressively, and that should allow us to regain some of the competitiveness issues or regain our position where it comes to being able to compete with the rest of the world and connect with the rest of the world.
Right. All right, good. Now, the next question is from Terence Teo. Oh, this is quite an interesting question. Why don't we just proceed with a complete circuit breaker due to the rise in community cases? Overall, this may be the most effective way to prevent further outbreaks. Wow.
Yes, I mean, there is a point. Some people feel that way.
Yep.
There's one school of thought that if you see any case, just go into a circuit breaker, go into a lockdown.
Yep.
The Australians do that. Even for 1 or 2 cases, immediate lockdown.
Right.
But it is very, very disruptive. It's very disruptive, and it's not as though doing that will assure you of zero infections, because at some point you have to open your borders.
Yes.
I mean, you can't keep countries like Australia, New Zealand have tried very hard to throttle back their flow of to the arrivals from the air travel. Very, very low volumes of air travel. So even in Australia, you'll read media reports of Australians not even able to come back to their own country because they have restricted the travel in terms of travel by air. If we were to do that in Singapore, and if we were to do that for not just 1 month, 2 months, like I said, short term, but we close our borders and we restrict travel, not just to travelers from overseas, but even to returning Singaporeans, and we do that for a year, I don't think we can sustain that kind of a closure. because Singapore is such a small, open economy. For us to be plugged into the world is an existential issue. It's not like New Zealand and Australia. So having a circuit breaker may sound like it's going to work, but I think if the minute you open up, the minute you connect with the world, you are bound to introduce, the virus into Singapore. And then it means if you were to take that approach, literally every other week, you will be in lockdown mode. And can we sustain that? How long can we sustain that? And what kind of impact will this have on businesses as well?
Right.
So we understand there are some who think this is a better approach, but if you look at the facts and if you consider Singapore's unique circumstance, it is actually very hard to implement such a policy.
All right, very nice. Okay, I just got word that we have over 1,000 people watching us now. So if you want to say hi to all these 1,000 people.
Hi, everyone.
Yes, thank you very much for joining us. If you have any questions, remember you can leave them in the comments below and we'll try to get them to Minister Wong later on, all right? I have, in the meantime, one question from Ming Han, which is quite a curious question. I have thought about this before. If everyone is fully vaccinated, will we still need to wear masks?
We are looking at that, right? So when we talk about a phase when a high proportion of people in Singapore are vaccinated, as I said, we will be able to get as close to normalcy as possible.
Right.
And under such a circumstance, we would be able to ease and relax many of our current safe management measures. Could have concerts, you could have football matches, sports events, and then we will have to review, besides all of these safe management measures, the mask wearing requirement. Does it still need to continue? We'll have to review that. I think potentially we could say if you're outdoors, you may not need to wear masks, but perhaps if you're in an indoor setting and it's a high risk and higher risk environment, mask wearing may still be required. So we are reviewing all of these measures in a scenario where we have reached, say, 75% of our population being vaccinated. Like I said, this might happen October, maybe earlier.
Right.
So at that stage, we will start reviewing all of the different measures we have and see how we can progressively ease and relax all of them.
Yeah. So
it would be a different situation.
Yeah.
Because at that time, then I think we might start thinking about how we treat, as we have said, at that time we treat COVID like an endemic disease.
Right.
What's an endemic disease? It means something that will never go away. It's a bit like chickenpox or the regular flu. And because we have such a high vaccination rate, in fact, the threat of COVID at that time will be not very different from a regular flu season.
Right.
In fact, based on the data that you see in Israel and in other countries. So if indeed this comes to pass, then we really need not be so fearful of COVID anymore, and we can start to reclaim our normal lives. And this will come soon. So let's not run ahead of ourselves. We have not reached our vaccination rates yet. So for now, because vaccination rates are not sufficiently high, we still need all the different controls and precautions that we are talking about so that we do not end up with a major outbreak before we end up with our target. So let's not get ahead of ourselves. Stay disciplined, stay focused, comply with all the measures, but at some point we will get to this target. Right.
Awesome. Okay. We've got another question with regards to the new measures. Someone mentioned this, I think Jin Homia SG, I don't know who that is, but can we bring our young baby out for a dine-in as one table? Both parents can take care of the baby at the same time.
Yeah, like I said, we're talking about 2 persons per table.
Right.
Yeah, I think it's very hard to enforce the rule if people ask for exceptions. Sometimes it could be a baby, sometimes it could be a toddler, sometimes it could be an elderly person.
Right.
So we understand everyone wants a little bit more and there are different circumstances, but across all F&B dining, it's very hard to enforce a rule where there are so many different variations. So the simple rule is 2 persons per table, and it applies across the board.
Right.
But you can have, if you're from the same household, more than 1 table, and it can be adjacent to you.
Yes, there you go. We've said that quite a couple of times now, all right? We have this question here. What is the roadmap out of this pandemic? Should reopening be tied to vaccination rates instead of case numbers?
Yeah, absolutely. Which is what I mentioned just now,
Right.
that we are looking at the 2 thresholds, the 2 milestones, 50% fully vaccinated
Right.
and 75% fully vaccinated. And those will be the markers for us to see more opening of the economy. So when we reach 50%, potentially we can do a more easing of some of the measures, but not entirely. And then when we reach 75%, a lot more easing, potentially, as I said, almost as close as we can get to living life normally. Because at that stage, we would have near maximum protection against the virus.
Yeah, basically, if you are ready to get vaccinated, please do so. Okay, go and register. Be like me, okay? Be a good student like me. All right, I have one more question here. Let's see. I have another question. Interesting question. Now, it is also with regards to the community measures. Is there a chance that the current restriction of 2 people for dining in will be lifted before mid-July? This one, people trying their luck to ask. How does the task force determine if it is safe to do so?
Sure.
Yeah.
Yeah. I don't have a crystal ball.
Right.
And it's very hard for me to tell you yes or no. But why did we say mid-July as the next step to get to 5%? It's because, number one, we want to see vaccination rates go up higher. And we are expecting some deliveries of vaccine supplies coming up in the next few days, coming week, which will allow us to ramp up our vaccination much more than where we are today. And number two, we also want to get the testing regime for the F&B and all the gym instructors. We want to get that testing regime in place. That's something new which we are putting in place, where we require people working in these higher risk settings to be tested regularly using the rapid test kits. So when these 2 are in place, I think it gives us a bit more confidence to start going to relaxing and then perhaps moving to the next stage of having 5 persons dining in.
There you go. All right. Now, someone saying, okay, this period from March 2020 till now must be extra taxing for you and your team. And this question is from Jume. She asks, I think, how do you de-stress yourself when you're off work on a short break during this time?
Well, all of us find our own ways to de-stress. I think it's extremely important that we take care of our own mental well-being.
Absolutely.
Otherwise, we can't function effectively.
Right.
So for me, I read, I listen to music, and I enjoy music. I play the guitar. I've been playing the guitar since I was a young boy. So
I didn't know that.
I continue to play
That's
in my room. And then I like to go out to nature. I enjoy nature walks, whether with myself or by myself or with my wife. And I find that doing that, helps me to relax, calms me down, and helps me to find inner peace. So that works very well for me. But like I said, I think everyone needs to find their own way of de-stressing.
Do you have a recommended hike? Because I have been hiking recently. Recently, I just got to Chestnut.
That's very
area.
nice.
Yes. Do you have any other recommendation I can check out?
I'm not sure about hike, but
Okay.
I like walking around MacRitchie.
Okay.
That's very nice. Sometimes
Nice.
I go to Bukit Timah.
Okay.
And then I, sometimes walk around Botanic Gardens.
Very nice. Okay, good. Now, we have a question from Sean Tan. How much free time do you have left after dealing with COVID and your work every day?
Not very much.
Nice. Okay, very nice. We've got a question next. Minister Gan Kim Yong and Ong Yi Kang arrow you again to do this? No
Not
lah. No, he never gonna arrow, okay? You want to say anything else about that?
No, it's this. I don't know whether you guys have invited them to come for the show, because this was an invitation from all of you.
Okay, he not arrowed. Okay, we arrow him lah, basically. All right. Next question. Does your wife still help you to cut your hair?
Actually, she does. This started during the circuit breaker,
Right.
because barbers were closed then. But I took a liking to it. I asked her to continue, and she has kindly obliged.
Very nice, very nice. Okay, do we have any more questions? If you guys have any more questions to share, please feel free to leave them in the comments below. Do I have any more questions? I think we are good with any... I'm waiting for the team to send me more questions. But again, if you guys are tuning in, thank you very much for joining us. Like I said, there were like 1,000 over viewers watching this live on the internet. So again, if you have any more questions, feel free to leave them in the comments below. Minister Wong, thank you again for joining us.
Happy to be here.
All right, let me double check with the team if they have any more questions. We've got one more question, I believe. Maybe since they are, preparing the questions, I ask you about your guitar.
Sure.
So what is one song that you say you're very good at? One song. I'm curious now.
Well, I play mainly rock and blues.
Oh.
So, Eric Clapton, B.B. King.
Nice.
Those sorts of things.
Yeah, I think a lot of people who are the younger ones might not get the references. I do though, which is great. Okay, nice. So you've been spending a lot of time kind of practicing that.
Well, I don't really practice anymore.
Okay.
I wish I could, because that's really the only way to improve. But I started playing when I was maybe 8 years old. When my dad gave me a guitar for my birthday, and I didn't go for any formal classes or training because we couldn't afford that. But he had a friend who could play the guitar quite well. So his friend taught me when I was growing up.
Nice.
And I've been playing since then, in church band, in wherever I could. And then when I went to university, I played further in America.
Right.
I went basking with my roommate, and I played in open mic bars. Then I keep on playing.
Okay, that's really cool. One day I hope we get to see you play some songs for us. Maybe.
When all this is over, hopefully.
Right, that's exactly it. So go get vaccinated. Once everybody is more so vaccinated, we'll be able to think about that in the future. All right, we have one final question, and that is from Umi. And the question is, how often will we need to take booster shots for COVID in the future? It's a really good question.
That's something that our experts are deliberating over. I think the evidence would show that with Pfizer and Moderna, these two vaccines, which we have now under our national program, in fact, the immunity does last for quite some time. Exactly how long we are still studying, but it's not a 6-month type thing. It's certainly more than a year.
Okay.
Right, so that gives us some confidence that we have good vaccines which will provide long-lasting immunity. But obviously, it's not going to be permanent. At some time, it will wane off, and we do think booster shots will be necessary. So we are now studying beyond this current round of vaccination. What might we do next year for booster shots? In fact, we will have to, if COVID ends up being endemic, meaning to say it's something we have to live with forever, then vaccination will be a regular part of our defense mechanism. So it's not just one time this year, it's not even one booster shot, but we literally have to go for regular jabs. We can't say yet how frequent this will be, but it's something that will have to happen on an ongoing basis, vaccination against COVID.
Right.
So that's something that we are already starting to prepare for. Beyond this year, what will be our subsequent vaccination program and how would it look like?
There you have it. All right. That is it. That is all our questions that we have today. But before we wrap it up, any final words for the people tuning in today?
Well, I just want to say, we all have been in this journey together since the start of the outbreak. It's been 16 months or so. I know many people will feel fatigued, probably a bit battle weary after all this, ups and downs with COVID. But we are getting there, right? The key is to continue with our vaccination program, which we are ramping up. So have confidence that we will soon reach our vaccination targets. In the meantime, we still need to be disciplined. We still need some restrictions and some safeguards, and that's why we have these staged and phased openings, starting with the next Monday and then continuing in mid-July. I know some of you may be disappointed that you can't do everything you wished you could, but please understand why we are putting in place these measures. We do not want a major outbreak and flare-up to happen before we have reached a sufficiently high level of vaccine coverage. So please cooperate with all the measures and have confidence and faith that we will get through this together.
All right, and with that, we have come to the end of today's episode of Off the Record. Thank you very much to Minister Lawrence Wong for being on the show with us today. And of course, thank you guys very much for tuning in. We hope we managed to answer all of your questions tonight. We will be back again next Saturday at 8 p.m. So join us then, where we will be talking about mental health issues. All right, so until next week, I'm Fauzi. Bye.
Thank you. Bye-bye.
Bye-bye.